Yes, Miss Adrian, can you put me as a co-host, please? Thank you.
Yes, let me try. Okay, sure. You're ready to go.
Thank you. All right. Okay.
All right. Uh, let me check if I did. Oh, right. So, angina isn't a disease itself. Instead, it's a symptom and a warning sign that your heart isn't getting enough oxygen-rich blood. And that lack of oxygen, called ischemia, is usually due to narrowed or blocked arteries supplying blood to the heart muscle. At cellular level, heart muscle cells need oxygen to make ATP, the energy our cells need. When oxygen is limited, they switch to anaerobic metabolism, producing lactic acid as a byproduct. And lactic acid irritates nerves and triggers the sensation of pain. That's right. Your heart is literally building up acid and sending it to your brain as a warning sign. So you can think of your heart as a hard-working engine, and like any engine, it needs fuel and oxygen to keep running. That oxygen comes from blood delivered through the coronary arteries, the small blood vessels wrapped around the heart. And now you can picture this. In a healthy person, these highways are clear and wide. Blood flows smoothly, but with coronary artery disease, fatty deposits called plaque build up on the artery walls, narrowing the path. So the result is there is less room for blood to flow, especially when demand increases. So angina often happens when the heart suddenly needs more oxygen than usual, such as walking upstairs, exercising, or experiencing emotional stress. When demand rises, but supply can't keep up, your heart muscle says, I need more oxygen, but I'm not getting it. That's the moment angina begins. So this is angina or chest pain, we call it. Uh, Actually, there are a few different types of angina, and each behaves a bit differently. The first kind would be stable angina, and this is the most common kind. It is triggered by physical activity or stress and relieved by rest or medication like nitroglycerin. So this is the predictable pattern, and you usually know what will set it off. The second type would be unstable angina. It occurs suddenly and unexpectedly, even at rest, and pain lasts longer or is more intense than stable angina. This is a medical emergency since it could signal an impending heart attack. Third type is variant angina, or you can call it Prince Meadows angina. It's caused by spasm in a coronary artery, but it's not plate buildup. And it usually occurs at rest, often at night or early morning, maybe triggered by cold, stress, or certain drugs. So here are three types of angina: stable, unstable, and variant. So what causes angina exactly? Well, most angina is a result of coronary artery disease, where fatty deposits called plaque build up on the walls of artery. narrowing the passageways and limiting blood flow, like I said earlier. Then how this happens, there are few stages actually. It's not just a one day thing. At first stage, endothelial injury happens in the blood vessels. So the inner lining of arteries is damaged from factors like high blood pressure, smoking, high cholesterol, diabetes. At second stage, the LDL cholesterol infiltration happens. The low density lipoprotein or bad cholesterol slips into the damaged areas. It gets oxidized and triggers an immune response. At third stage, inflammation and plaque formation take place. White blood cells, namely macrophages, which are immune cells, try to digest the LDL. These forms foam cells and eventually fatty streaks and plaque. Over time, the plaque grows and hardens, narrowing the artery. At fourth stage, reduced blood flow happens. The narrowed lumen limits how much blood can pass through. At rest, the heart may get by, but during activity or stress, it can't meet demand, thus causing angina. Well, like I said, some factors can contribute to angina, including physical exertion like climbing stairs or exercising, emotional stress like anxiety can increase your heart's oxygen demand. Cold weather can constrict blood vessels and less blood flows to your heart. And also heavy meals can trigger one because your body diverts blood to your stomach so that fewer blood goes to heart. Smoking is also another factor because it narrows arteries and reduces oxygen in the blood. Meanwhile, it is a carcinogen, meaning it can cause cancer. Then what does angina feel like? Well, it doesn't always feel like pain. Some people describe it as pressure, tightness, or heaviness in the chest. Chest discomfort such as pressure, squeezing, burning, or fullness, usually behind the breastbone. Pain can radiate to other areas such as arms, shoulders, neck, jaw, back. Sweating or dizziness can accompany the chest discomfort. People can also have shortness of breath, especially with physical exertion. Symptoms such as nausea or fatigue are more commonly seen in ladies. Each episode usually lasts a few minutes and goes away with rest. But any chest pain should always be taken seriously, especially if it's new, worsening, or doesn't go away with rest. Now let's see how is angina treated. Treatment of angina focuses on improving blood flow to the heart and reducing the risk of a heart attack. Medications such as nitrates like nitroglycerin helps relax blood vessels and relieve pain. Also, beta blockers helps reduce heart workload. Calcium channel blockers help arteries relax. Statins helps lower cholesterol and stabilize plaque. aspirin help prevent blood clots. So these are the most often used medicines for patients with angina. So meanwhile, patients need to adjust their lifestyle. For example, quit smoking if they do, eat a heart healthy diet, exercise safely, and control stress levels. But for more severe cases, medical procedures are needed, such as angioplasty, meaning that a balloon is placed inside your artery, helps widen the blocked artery. Then a stent is placed to keep it open. Another surgery is bypass surgery. It can create a new route for blood to flow around a blocked artery. So these are the two, mostly used medical procedures by the doctor, by the surgeon. Then we always say that prevention is better than treatment. So here are some tips for prevention. Because we can't always control our genetics, but we can control many of the risk factors. So first tip would be living heart smart. Don't smoke, like I said, because it damages blood vessels and lowers oxygen. Another one, eat heart healthy. You can think Mediterranean food diet, including veggies, fruits, whole grains, lean protein, and healthy fats in your meals. Also, stay active. Aim for 30 minutes of moderate exercise most days. If you are not sure whether you can do that, you can, take advice from our doctors. Also, manage stress. Try mindfulness therapy or breathing exercises. Also, you need to control medical conditions if you have any. Keep your blood pressure, cholesterol, and blood sugar in check. Treat underlying conditions like diabetes or obesity. Meanwhile, take medications as prescribed by your doctor to manage your heart health. Meanwhile, Green World Health products help to prevent angina and relieve symptoms. Here we recommend Danshin Combo Capsule, Super CoQ10 Capsule, and Lipid Care Tea. We will show one by one. For the Danshin Combo, the herbal ingredients of this product help dilate the arteries, supplying blood to the heart muscle, thus providing more oxygen and nutrients to sustain the heart function. For one thing, it inhibits the formation and progression of atherosclerotic plaques. The active ingredients have been found to inhibit the formation and progression of those plaques, which are a hallmark of coronary artery disease. And also the herbal ingredients can reduce the buildup of fatty deposits and cholesterol in the arteries, potentially lowering the risk of blockages that restrict blood flow to the heart. Secondly, it has anti-inflammatory properties. Because inflammation plays a major role in the development and progression of atherosclerosis. Danshin Combo Capsule has anti-inflammatory properties, helping to reduce the inflammation within blood vessels that can contribute to the formation of plaques. Meanwhile, the tension combo contains multiple antioxidants. By scavenging free radicals and reducing oxidative stress, it helps protect the blood vessels and heart tissue from damage. Oxidative stress accelerates the aging of blood vessels and contributes to heart disease. So this protective effect can be particularly beneficial in reducing the risk of heart attacks and stroke. So for preventative purpose, you may take 1 to 2 capsules each time, 1 to 2 times in a day. While in case of emergency, you may open the capsule and put the content under your tongue and seek immediate medical help. Another product we recommend is Super CoQ10. Coenzyme Q10 is a vitamin-like compound found in every cell of our body. It plays a crucial role in the production of cellular energy, specifically in the mitochondria, the tiny power plants inside our cells. In the heart, which is one of the most energy-hungry organs, CoQ10 is especially important. So, Super CoQ10 capsule helps with angina because it improves the energy supply to heart muscle. Secondly, it reduces frequency and severity of angina attacks. And thirdly, it improves endothelial function of blood vessels, helps regulate dilation and blood flow. Fourthly, it may help in statin users. Statins, which are cholesterol-lowering drugs, can deplete natural CoQ10 levels. So supplementing CoQ10 can help restore those depleted levels and possibly reducing side effects, reducing fatigue and also muscle-related side effects, and supporting heart energy. So you can take 2 capsules in a day with or after meal for prevention purpose. Another one, lipid care tea, helps lower blood cholesterol levels, particularly the bad cholesterol and triglycerides, while raising the good cholesterol, HDL. This helps in reducing the risk of fatty deposits in the arteries and thereby supports overall cardiovascular health. And the herbal ingredients of lipid care tea also helps reduce lipid peroxidation, which is the oxidative degradation of lipids in the blood. This process is a contributing factor in the development of atherosclerosis and heart disease. So you may brew 1 to 2 sachet each time and take 2 to 3 times each day for prevention purpose. Well, now we are coming to the end of this section. We should know that angina is a warning sign, not something to ignore. And it's when your heart's trying to tell you something. So make sure you are listening your heart. So the good news are with the right lifestyle, treatment, and monitoring, most people with angina can lead full active lives. Let's take preventative moves together to prevent those things from happening. So this is the first section. I will stop sharing this one. All right. So let me share the second one, heart attack. All right. Oh, you can see the screen, right? Heart attack. So all right. So let me see. Can I ask to head office? Oh, what happened? Let me share my screen again. All right, so this is the second section of today's training, heart attack. You can imagine that your heart is a powerful pump, like I said. It's working day and night without rest to send blood coursing through our body. Now, imagine what happens if one of the pipes supplying that pump suddenly gets blocked. That pump suddenly gets, that's what a heart attack is. And it's as serious as it sounds. So if we say that angina is a symptom rather than a disease, then heart attack is definitely a disease. Heart attack is also known as myocardial infarction. It happens when blood flow to a part of the heart is suddenly cut off. Without blood, that section of heart muscle doesn't get oxygen, and within minutes it begins to die. The longer the blockage goes untreated, the greater the damage, and the higher the risk of death or long-term heart problems. It's a medical emergency, but the good news is most heart attacks are preventable. All right. Here is the cause of heart attack. Like angina, the main cause of heart attack is coronary artery disease. It happens gradually, likewise. At first stage, plaque buildup, and your heart gets blood through coronary arteries. Over time, fat, cholesterol, calcium, and other waste products from your blood build up in the walls of coronary artery. This sticky sludge is called plaque, and this process is called atherosclerosis. And it makes the artery narrow and stiff.
Okay, the slides are
At
not
second
moving.
stage, rupture and clot happens. One day, a piece of that plaque breaks off your body, thinking there's an injury. So it forms a blood clot to seal the damage.
Hello, your
Mr.
slide
Ray,
are not
sorry.
moving.
May completely block the artery. No. That clot may completely block the artery and cutting off blood flow to part of the heart muscle. Then oxygen stops reaching that part of the heart. If not quickly reopened, the heart tissue begins to die. And this happens in 15 to 30 minutes. The longer the artery is blocked. Oh, sorry. So the PP slide is not working right. Let me see. Okay. Is it working now? You can see my screen, right?
Yes, we can see, madam.
Thank you.
It's okay. It's okay. Now we
Yes.
can see.
Thank you. Thank you, gentlemen. If not quickly reopened, the heart tissue begins to die. And this happens in 15 to 30 minutes, like I said. So the longer the artery is blocked, the more heart muscle is lost. If the damage is bad enough, the heart may stop pumping properly or stop altogether. So the sooner treatment starts, the more heart muscle can be saved. That's why doctors say time is muscle. If you are having symptoms like chest pain, shortness of breath, nausea, sweating, arm pain, don't wait. Call emergency service immediately. Let's see the risk factors. Knowing who's at risk of a heart attack can be life-saving. Some risks are out of our control, but many are related to lifestyle and can be reduced or managed. First things first, let's see the uncontrollable risk factors, like age, your family history, biological sex, ethnicity. Men over 45 and women over 55 are at higher risk. Risk continues to climb with age due to longer exposure to things like high blood pressure and cholesterol buildup. As for family history, if your parents, your siblings, or close relatives had heart disease, especially at a young age, your risk is higher. Also, genetics can affect cholesterol levels, blood pressure, and how your arteries respond to injury. As for biological sex, men tend to have heart attacks earlier because women have a unique risk profile. After menopause, risk catches up due to hormonal changes, and symptoms can be less classic, which may lead to delayed diagnosis. Another factor is ethnicity. Some ethnic groups, such as South Asians, African Americans, and Latinos, are at higher risk due to genetic, dietary, or social factors. Now, let's see some controllable risk factors. These are the ones you can do something about, and they make up the majority of heart attack cases. First one, high blood pressure. A constant pressure on artery walls weakens them and accelerates plaque buildup. It is often called the silent killer because it has no symptoms, oftentimes. Second factor, high cholesterol, especially high LDL cholesterol, the bad cholesterol, and also low HDL cholesterol, the good one. LDL contributes to plaque in arteries, while HDL helps remove it. Another factor, smoking. We don't need to further talking about that. So fourth one, diabetes or insulin resistance. We know that high blood sugar damages our blood vessels. Diabetes often have other risk factors like obesity, high blood pressure, and high cholesterol. So risk of a heart attack is 2 to 4 times higher in people with diabetes. The fifth factor, obesity, especially belly fat, because central fat or visceral fat increases inflammation and raises the risk of heart disease more than fat elsewhere. It is often connected to insulin resistance, high blood pressure, and high cholesterol. So you can see from here that Many factors are actually correlated with each other. If you have one, you may have others as well. Another controllable risk factor is physical inactivity. A sedentary lifestyle increases nearly every other risk factor: blood pressure, cholesterol, blood sugar, and body weight. So regular exercise keeps the heart and arteries healthy. The seventh factor is unhealthy diet. High in saturated or trans fats, salt, refined sugars, while low in fruits, vegetables, fiber, and unhealthy fats leads to obesity, high blood pressure, diabetes, and cholesterol problems. Also, excessive alcohol use can raise blood pressure and triglycerides, lead to weight gain and irregular heart rhythms. Likewise, chronic stress or poor mental health is another contributing factor to heart attack. Because constant stress increases cortisol, which is a stress hormone. It affects blood pressure and inflammation. Depression and social isolation are linked to higher heart disease risk, especially in women. So with those controllable risk factors in mind, you know what to do next, right? A heart attack don't always look like dramatic movie scenes. Some are subtle, especially in women. The symptoms are not that typical like men. The common symptoms include chest pain or pressure, like an elephant sitting on your chest. Or you may have pain spreading to the shoulder, arm, back, neck, or jaw. You may have shortness of breath. You may have sweating, nausea, or lightheadedness. If you or someone near you might be having a heart attack, just call emergency service immediately. Then how is heart attack treated? When someone has a heart attack, every minute counts. So emergency services should be called immediately. Meanwhile, through an aspirin, it helps thin the blood and slow clot formation. Or the patient can take nitroglycerin sublingually. That helps open up blood vessels and relieve chest pain. Meanwhile, patient should keep calm and still, avoid unnecessary physical activity that could worsen the damage. Within the first minutes to an hour of a heart attack, the chances of saving heart muscle and reducing damage are highest. The golden hour refers to the crucial first hour after a heart attack, when treatment is most effective in preserving heart tissue. Once you reach the emergency room, doctors will quickly confirm a heart attack using ECG, the electrocardiogram, which detects abnormal heart rhythms or damage. Also, blood tests will measure cardiac enzymes like troponin, which rise after heart cells die. So the goal of emergency treatment is simple: restore blood flow. These may include clot-busting drugs like aspirin or nitroglycerin, which we advised the patients to, take sublingually at the first time of heart attack. Also, angioplasty and stent placement is needed. This is the most common and preferred method for people with a narrowed artery. A catheter is inserted into a blood vessel. It's guided to the blocked coronary artery. Then a tiny balloon is placed to open the artery. Then a stent is placed to keep it open. This is the surgery. This is the procedure. Another surgery is coronary bypass surgery. It's like that we mentioned in angina because they both caused by a narrowed artery. The surgery reroutes blood around the blockage. It is used in more severe cases or multiple blockages. Surgeons take a blood vessel from the chest or leg. They bypass the blocked arteries by creating a new path for blood to flow. After the artery is reopened, patients will stay in the hospital for 3 to 7 days for monitoring heart rhythm and preventing complications like arrhythmia or heart failure. And after discharge from the hospital, lifestyle changes and medications like blood thinners, beta blockers, and statins help prevent another heart attack. Now we come to the prevention method. We see that the best heart attack is the one that never happens. So prevention is powerful. It starts with everyday choices, like cut back on saturated fats, salt, and added sugars. Load up on veggies, fruits, whole grains, and healthy fats. Aim for 30 minutes of moderate exercise most days. Manage your stress, especially chronic stress. And monitor your numbers, your blood pressure, cholesterol, blood sugar levels. Also, if your doctor gives your medications for high blood pressure, cholesterol, or diabetes, take them constantly. Meanwhile, Greenworld Health products help. They help in many ways. We have Denshin Combo, Super CoQ10, Deep Sea Fish Oil, safeguarding your heart health. So for Denshin Combo capsule, once you or someone else show the symptoms of a heart attack, your first action is always seek immediately medical help. While waiting for the ambulance to arrive, you may open the capsule of Denshin Combo and put the powder under the tongue of the individual with heart attack. This method is called sublingual administration. The herbal ingredients of this product help dilate the arteries. And since we have a network of blood vessels under our tongues, the active ingredients can be absorbed directly into the bloodstream, bypassing the digestive system and also the liver. It is effective and very timely. It has a faster onset of action and higher bioavailability compared to oral administration. Another choice is Super CoQ10. Like I said, the heart muscle requires a lot of energy to function efficiently. After a heart attack, the affected heart muscle can become weakened or damaged due to reduced blood flow. CoQ10 helps improve the energy production in heart cells by facilitating the production of ATP, which is the primary energy carrier in cells. This can support the healing process and help improve heart function after a heart attack. So this product is helping with heart health so that you can have lower, chances of having another heart attack later. Another product recommended is deep sea fish oil capsule. One of the main culprits of a heart attack is atherosclerosis, which is one of the consequences of high blood lipid levels and high blood viscosity. Omega-3 fatty acids, especially EPA and DHA, help decrease triglyceride synthesis in the liver by altering the way the body processes fats. This reduction in triglycerides can lower the overall risk of atherosclerosis. So taking deep sea fish oil helps prevent heart attack from happening. That's all for these parts about heart attack. So we say that heart attacks don't have to be inevitable. With a better understanding of the causes and how to take actions, we can change the story. All right, so let me set Madam Linda June as co-host so that she can share her screen with us. Now let's welcome.
Hello, everyone. Nice to see you online. My name is Linda Zheng. Today, I will share with you about common health conditions, constipation. So let's share the PPT.
You need me to share. 你需要我播放 PPT 是吗？
哦我来放。
好的。
Okay. Constipation isn't exactly a glamorous subject, but it's an important one. Just hearing the word alone makes many people shift uncomfortably in their seats. It's one of those bodily issues that's awkward to talk about, but incredibly common. It affects up to 20% of people worldwide at some point in their lives. If you have ever found yourself sitting on the toilet longer than a scroll through social media, wondering why your body isn't cooperating, you are not alone. Now, let's dive into the science behind constipation. Okay, next. First thing is first, what is constipation? In simple terms, constipation is when your bowel movements become infrequent or difficult to pass. Medically, it's often defined as having fewer than 3 bowel movements per week. But it's not just about frequency. Stools can also become hard, dry, and painful to pass. Some people may also feel like they haven't fully emptied their bowels even after going. Think of your digestive system like a conveyor belt. Food goes in, nutrients get absorbed, and waste moves along to be expelled. When the conveyor slows down or gets jammed, waste sits longer in the colon, where more water gets absorbed, making stools drier and harder. That's constipation in action. Okay, next. Constipation is very common and affects people all around the world. Tens of millions of people worldwide deal with constipation regularly. It's more common in women, old adults, and people with lower physical activity levels or poor diets. Studies indicate that approximately 31.4% of individuals in Africa experience functional constipation. the highest prevalence among all continents. Among older adults aged 60 and above, that number jumps to about 33%, highlighting age as a significant risk factor. Constipation is also common in children, especially during toilet training or after starting school. Okay, next, how does constipation happen? There are many culprits causing constipation, and they often work together like a gun of digestive delinquents. Number one, low fiber diet. Fiber is the unsung hero of digestion. It adds bulk and keeps things moving. A diet low in fruits, vegetables, and whole grains can bring your digestive system to a crawl. Number two, dehydration. Water helps soften stool. Without enough fluid, your body absorbs water from your food waste, drying it out and making it hard to pass. Number three, lack of physical activity. Movement helps stimulate intestinal activity. Sedentary lifestyles can slow down your gut. Number four, ignoring the urge, holding in bowel movements regularly because you are busy and comfortable using public restrooms or just not in the mood can desensitize your body's natural signals. Number five, medications. Some drugs like opioids, antidepressants, and iron supplements have constipation as a side effect. Number six, medical conditions. Issues like irritable bowel syndrome, IBS, diabetes, hypothyroidism, and even neurological disorders like Parkinson's disease can impact digestion. Number seven, aging. As we age, our digestive systems naturally slow down, and many older adults take medications or have health conditions that increase constipation risk. Okay, next. Constipation is more than just a minor inconvenience. It can significantly impact your overall health and quality of life, especially if it becomes chronic. Constipation can directly impact digestive system and cause, number one, discomfort and pain, like straining during bowel movements can cause abdominal pain, cramping, and bloating. Hardened stools can cause tiny tears in the anus, leading to pain and bleeding. Number two, hemorrhoids. Straining increases pressure on veins in the rectum and anus, often leading to hemorrhoids, swollen veins that can be painful or itchy and may bleed. Number three, fecal impaction. If stool becomes severely hard and stuck, it can form a fecal impaction, which might require medical intervention to remove. Number four, rectal prolapse. In extreme or chronic cases, straining can cause rectal prolapse, where a portion of the rectum protrudes outside the anus. Number five, increase the risk of colorectal cancer. Chronic constipation can stretch the colon and weaken its muscles, making the condition worse over time. Long-term constipation can cause inflammatory responses on the gut wall and increase the chances of getting colorectal cancer. Meanwhile, constipation can impact other body systems and lead to like urinary tract issues. The full colon can press on the bladder, causing urinary retention or frequent urination. Especially in women, constipation can increase the risk of urinary tract infections, like weak immunity. Slower transit time can disrupt the natural balance of gut bacteria, potentially leading to dysbiosis, which affects digestion and immunity. We know that there is a brain-gut axis inside our body. Once our gut health is compromised due to chronic constipation, there will be a problem with mental and emotional health. More often, people can have anxiety and depression, often due to the ongoing discomfort and embarrassment. Regular bowel issues can also impact daily activities, travel, and social interaction, affecting overall well-being. Okay, next, how to treat and prevent constipation? Luckily, most cases of constipation aren't serious and can be managed with simple changes. Here is what you can do. Number one, increase fiber intake. Start by boosting your fiber intake. Adults should aim for 25 to 35 grams of fiber daily. Whole grains, beans, fruits like apples, pears, and berries, and vegetables like broccoli and carrots are your friends. Number two, hydrate like you mean it. Drink plenty of fluids, especially water. About 8 cups, like 2 liters a day, is a good general target. But your needs may vary based on activity level, climate, and health. Number three, move your body. You can do some workout regularly, like walking, yoga, or cycling. Can stimulate your bowels. Aim for at least 30 minutes of movement most days of the week. Number four, establish a routine. Try to go to the bathroom at the same time every day, ideally after meals. Respond promptly to nature's call instead of waiting. Number five, manage stress, which can disrupt digestion for many people. Number six, use laxatives cautiously. Over-the-counter laxatives like fiber supplements, stool softeners, or stimulant laxatives can provide temporary relief, but they shouldn't be a long-term solution without medical supervision. Overuse can lead to dependency. Number seven, talk to a doctor. If constipation is chronic, severe, or accompanied by pain, bleeding, or weight loss, it's time to seek medical advice. There could be an underlying issue that needs more than home remedy. Okay, next. Meanwhile, green world health products can help in many ways. And the first, in cleansing tea, the herbal ingredients in this tea help with the peristalsis of large intestine, thus supporting healthy bowel movements. The second, clear 常静静 fresh drink helps accelerate the peristalsis of large intestine and promote the growth of beneficial bacteria in the gut. Clear 常静静 fresh drink is suggested to be consumed until the bowel movement is normal. Then you can shift to other products. Okay, next, Chitin capsule. Chitin is a natural fiber made from the shells of crustaceans like shrimp and crabs. It can help add bulk to stool. Chitin is a type of indigestible fiber. It absorbs water and swells up in your intestine. Bulkier stool stimulates the intestines to move things along more easily. It can also improve bowel movements. Like other fibers, chitin can help regulate how often you go to the bathroom by making the stool easier to pass. Promote gut health. Some studies suggest chitin can slightly encourage the growth of good gut bacteria, which can also help keep bowel movements regular over time. However, chitin is not a strong laxative like aloe vera or senna. It's more like a gentle, supportive fiber that helps if your constipation is mild or caused by not getting enough fiber in your diet. When taking chitin capsule, make sure you drink plenty of water, over 2,000 milliliters of water intake per day, because staying hydrated helps prevent stool from becoming hard and dry. Okay, next product, meal cellulose tablet. This is a dietary fiber of plant source. It alleviates constipation effectively. Here is how it works. Increase stool bulk. Insoluble fiber in this product passes through the digestive system relatively intact. It absorbs water and adds bulk to the stool, which helps stimulate the intestinal walls and promote movement through the colon. Soften stool. Soluble fiber in this product forms a gel-like substance when it absorbs water. This softens the stool, making it easier to pass. Promotes gut health. Soluble fibers act as prebiotics, feeding beneficial gut bacteria. These bacteria produce short-chain fatty acids, which improve colonic function and motility. The next stimulates peristalsis. The bulk and hydration from fiber stimulate the muscles of the colon, peristalsis, helping to push waste along the digestive tract. It also regulates bowel movement. Regular fiber intake helps create a more consistent and predictable stool formation, reducing the likelihood of constipation. Okay, next, aloe vera plus capsule. Aloe vera contains anthraquinones, which are natural compounds found in the latex of the plant, the yellowish substance just under the skin of the leaf. These compounds have a stimulant effect on the bowel, which can help promote bowel movement. The anthraquinones increase the peristalsis that push stool through the intestines, helping to relieve constipation. Okay, next. Based on all the above content, we understand the importance of intestinal health. It is a reflection of your overall well-being. Treat your gut with care, feed it well. Take some mild exercise, stay hydrated, and listen to its signals. A smooth digestive journey isn't just about comfort. It's about thriving from the inside out. So, the next time you feel a little backed up, remember It's not just in your head, it's in your gut. And your body is asking for a little tender, loving care. Okay, this topic sharing comes to an end. Next, we will continue to share with you about diarrhea, a common health condition. Diarrhea. Okay, let's get started. To be honest, nobody wants to talk about diarrhea, yet almost everyone experiences it. Whether it's a quick tummy bug or an unfortunate reaction to street food abroad, diarrhea has a way of making its presence known. It's messy, uncomfortable, sometimes embarrassing, and in severe cases, even dangerous. So, next, let's have a deep look at this commonly seen health condition. What's diarrhea? Diarrhea is a medical term for loose, watery stools that occur more frequently than normal, usually more than 3 times a day. It's your body's way of flushing out unwanted gas or irritants from your digestive system. Unlike constipation, which is like a traffic jam in your intestines, diarrhea is a high-speed highway exit. Food and fluids pass through the intestines too quickly, and your body doesn't get a chance to absorb enough water or nutrients. The result is watery stools and frequent bathroom visits. There are 2 main types, acute and chronic. Acute diarrhea is a short-term one, usually lasting 1 to 3 days. It is most common and typically resolves on its own. Chronic diarrhea lasts more than 2 weeks. This type often points to underlying health conditions and requires medical attention. Okay, next. How diarrhea affects health is not treated properly. When diarrhea isn't treated quickly and properly, it can cause serious harm to the body, especially in young children, the elderly, and people who are already sick, since it can lead to 1. Dehydration. Diarrhea causes loss of large amounts of water and salts, electrolytes from the body. Without enough water and electrolytes, the body can't function normally. Signs of the dehydration include dry mouth, extreme thirst, little or no urine, or dark yellow urine, sunken eyes, weakness, dizziness. In children, sunken soft spot on the head, crying without tears. Severe dehydration can lead to shock, kidney failure, or death if not corrected fast. Number 2, loss of essential nutrients. Diarrhea prevents proper absorption of nutrients like vitamins, minerals, and energy from food. Over time, this can cause malnutrition. This is especially dangerous for children because malnutrition stunts growth, weakens the immune system, and affects brain development. Number 3, electrolyte imbalance. Electrolytes like sodium, potassium, and chloride are critical for muscle function, including the heart muscle, nerve signals, and fluid balance. Losing too much electrolytes can cause muscles cramps, irregular heartbeat, seizures, confusion in very bad cases. Electrolyte imbalance can cause coma or death. Number 4, damage to the intestine. Certain infections like Shigella or Entamoeba histolytica can damage the intestinal lining. This can lead to long-term problems like chronic diarrhea, irritable bowel syndrome, IBS, and problems absorbing nutrients, malabsorption. Number 5, weakened immune system. Dehydration, nutrient loss, and gut damage all make the immune system weaker. A weaker immune system increases the risk of getting more infections, including respiratory infections, skin infections, and others. Number 6, other complications include kidney failure, which is from severe dehydration. Blood infection will occur if bacteria from the gut enter the bloodstream, or even death, especially from cholera and other severe diarrhea diseases, if not treated quickly with rehydration. In 2020, Africa experienced an estimated 1.01 billion cases of diarrhea, resulting in approximately 550,000 deaths. These figures encompass all age groups, highlighting the extensive impact of diarrheal diseases across the continent. Children under 5 are especially vulnerable, and diarrhea is the second leading cause of death among children under 5 in sub-Saharan Africa. Eastern Africa has the highest number of cases in both children under 5 and individuals over 5, and Western Africa has the highest number of deaths in both age groups, while Southern Africa has the lowest number of cases and deaths across all age groups. What causes diarrhea? Firstly, we need to know that diarrhea is a symptom, not a disease, and it can have lots of causes. 1, infectious causes, the most common. The majority of diarrhea cases in Africa are triggered by infections from bacteria, viruses, or parasites, often spread through contaminated food, water, or dirty hands. Bacteria infections include Escherichia coli, Salmonella, Shigella, Vibrio cholerae, and Campylobacter. Viral infections include rotavirus, especially deadly for young children, norovirus, and adenovirus. Parasitic infections include Giardia lamblia, Entamoeba histolytica, causes amoebic density, Redeus species. These infections happen easily where there is poor sanitation, unsafe drinking water, and low hygiene practices. 2, environmental and living conditions. Unsafe drinking water. Millions of people in rural and urban slum areas rely on water sources contaminated with human or animal waste. Poor sanitation, lack of proper toilets means open defecation. It's common in some areas, spreading disease into water and food supplies. Overcrowding in refugee camps, informal settlements, or dense urban areas, diseases spread rapidly. Like climate factors, like floods, droughts, and rainy seasons can disrupt clean water supply and sewage systems, increasing disease risk. 3. Malnutrition and weak immune system. Malnourished children are much more likely to get diarrhea and to die from it. Meanwhile, poor nutrition weakens the immune system, making it harder to fight off infections. At the same time, diarrhea itself worsens malnutrition, creating a vicious cycle. When a child has diarrhea, they lose nutrients and calories. 4. Healthcare access issues. Limited access to medical care. Many rural areas have few clinics or trained health workers. Low vaccination rates. Vaccines like the rotavirus vaccine greatly reduce diarrhea deaths, but aren't always widely available. Delayed treatment, oral rehydration solutions, ORS, and zinc supplements are cheap and effective, but many don't get them quickly enough. Okay, so how to treat diarrhea? For most people, diarrhea clears up on its own, but you can support your body's recovery and ease symptoms with the following strategies. Number 1, rehydrate. This is crucial. Diarrhea leads to water and electrolyte loss. Sip fluids like water, clear broth, or oral rehydration solutions. Avoid caffeine and alcohol, which can dehydrate you further. 2, follow the BRAT diet. Bananas, rice, applesauce, and toast, these bland foods are gentle on the gut and can help firm up stools. But remember, this is a short-term approach. Long-term, your body needs a balanced diet. 3, consider anti-diarrheal medication. Over-the-counter meds like Imodium or Pepto-Bismol can help if the cause is not an infection. If diarrhea is due to bacteria or parasites, this can worsen the problem by trapping pathogens in your gut. 4, probiotics. These good bacteria may help restore gut balance, especially after antibiotic use. Yogurt with leaf cultures or probiotics supplements can be beneficial. 4, see a doctor if diarrhea lasts more than a few days. There's blood or pus in the stool. You have a fever over 38.9 degrees Celsius. You show signs of dehydration, dry mouth, dizziness, dark urine. It affects a young child, elderly person, or someone with a weakened immune system. Okay, next. Greenbelt health products also help to manage diarrhea. Number 1, garlic oil capsule. Garlic, especially garlic oil, has long been used in traditional medicine for treating many gut problems, including diarrhea. It may help with diarrhea by providing antimicrobial, anti-inflammatory, and probiotics effects that support gut health and digestion. It is particularly useful if the diarrhea is caused by an infection or inflammation in the gut. However, garlic should not be considered a primary treatment for diarrhea, especially in cases caused by serious infections or underlying chronic conditions. Number 2, propolis plus capsule. Propolis may help manage diarrhea by providing antimicrobial, anti-inflammatory, and gut healing benefits. It could be especially useful for diarrhea caused by infection, intestinal inflammation, or gut irritation. Okay, next, zinc tablet. Zinc can be a helpful and effective supplement for managing and preventing diarrhea, particularly in cases of infectious diarrhea, acute diarrhea in children, and diarrhea related to intestinal inflammation or malabsorption. Statistics show zinc supplementation during diarrhea episodes can reduce the duration and severity of diarrhea by about 25%. Zinc helps by supporting the immune system, improving gut health, reducing the severity of symptoms, and aiding in the absorption of fluids and electrolytes. However, zinc should be used according to recommended dosages, and it is important to seek medical advice if diarrhea is severe, persistent, or accompanied by signs of dehydration or other serious symptoms. 4. Blueberry juice, high VC. Diarrhea leads to a loss of fluids and electrolytes such as sodium, potassium, chloride, and bicarbonate, which can quickly lead to dehydration and electrolyte imbalances. Drinking blueberry juice, high VC, can quickly replenish the body with fluids and electrolytes. The anthocyanins may help repair the damage to the intestinal wall by the diarrhea. How to prevent diarrhea, and also with many things in life, an ounce of prevention is worth a pound of issues. Number 1, wash your hands. Basic hygiene goes a long way. Scrub with soap for at least 20 seconds, especially before eating or after using the bathroom. Number 2, watch what you eat and drink. When traveling, stick to bottled or filtered water. Avoid raw or undercooked meats and unwashed produce. Be cautious with street food in high-risk areas. Provide balanced diets rich in fruits, vegetables, grains, and protein. Well-nourished children are better at fighting infection. Promote exclusive breastfeeding for the first 6 months. 3, cook food properly. Use a food thermometer to ensure meats are cooked to safe internal temperature. Reheat leftovers thoroughly. 4, stay updated on vaccines. The rotavirus vaccine, for example, helps protect infants from a major cause of severe diarrhea. 5, manage chronic conditions. If you have irritable bowel syndrome, inflammatory bowel disease, or food intolerances, work with a doctor or a dietitian to identify triggers and create a digestive-friendly diet. Okay, next. Dietary may be nature's way of fleshing out problems, but it's also a sign that your gut needs some care. Whether it's a one-day nuisance or a chronic condition, understanding what's going on inside helps you take control outside. Listen to your body, stay hydrated, and your gut will thank you. And so will your toilet. Okay, that's all for today's presentation. Thank you for being with us. Thank you.
Thank you, Miss Linda.
All right. Miss Linda, thank you very much for your wonderful training. Sorry, my pictures result is the electricity just off now. So our African leaders and distributors, well, this evening we really enjoyed the training from Miss Shadrine and also Miss Linda. It's very wonderful training. Miss Linda, your English is very well. We can understand it easily what explained this evening. Also, Miss Shadrine. Ladies and gentlemen, Miss Shadrine and Miss Linda used to share the Zoom online training to Egypt branch, to Kenya branch, and today we have both of them in our Friday Zoom online training, and we really enjoy the training given by Miss Shadrine and Miss Linda, especially on the angina and then heart attack by Miss Shadrine, and also the constipation and diarrhea by Miss Linda. We really learned a lot. It's a very wonderful training. Myself, I would like to say thank you very much for the training. And then we know that Madam Ray is available because she's on the way to Dubai. Okay, so maybe even next week we are going to see more of the training from Ms. Shadrin and Ms. Linda. Just stay tuned in your WhatsApp group. I will share the invitation. And about today's training, I will also share the training through the WhatsApp group training, so you don't need to worry. We are going to learn together. This is a very good training, and we hope that we can have more of this kind of training in the future. But now I think we still have 3 minutes. Maybe somebody, you can unmute yourself and you want to say something or you want to ask any question. Yeah, we have our leaders here, Madam Malta Bele, Madam Abigail. Madam Malta, maybe you can share a little bit of thing of today's training. Yes, Mr. Lurka, please, from Malawi. You can unmute yourself, sir.
Hello, Mr. Budumai, and Wolf, thank you very much for the fine training. I just wanted to ask on the constipation and infertility. Would constipation cause you not to conceive?
Sorry, Mr. Luca, we cannot hear your voice. Can you speak loud, please?
Moment. I'm asking,
Hello?
would constipation cause difficulty in conceiving?
Conceive.
Yes.
So you're asking if the constipation can affect a woman to have problems to get pregnant.
That's right.
Yeah. All right. Maybe Miss Shadrin, Miss Linda, you want to answer the question?
It is a very good question. I have never thought of that.
Yeah, it is very
Yes,
good question.
constipation, you say, yes, it can somehow affect a lady getting pregnant because once you have chronic constipation for a long time, your intestine will reabsorb the water as well as the toxin inside your, colon, inside your intestine. And so those toxins will, reabsorb into your bloodstream and circulate inside your whole body for a while. So in that case, those toxins will, make you, toxicated, for more times. So in that case, that will affect your whole body, somehow affect your liver. Your liver is the largest organ inside your body for detoxification. So, and also it affects your heart, your heart, because your heart is the one that pumps all the bloodstream inside your body. Once the toxins inside your bloodstream getting much more, your heart will be, toxified, and somehow that will, gradually affect your, your conceiving, having a baby, will affect your womb, affect your uterus, right? And also for ladies, this the structure, the physiological structure of ladies, reproductive system, the anus is very close to vagina, right? If you have long-term constipation, those, toxins inside your colon will, go inside your vagina somehow. I think that will be influence for the having a baby for that lady. So timely, management of the constipation is much good way, much better way to, for a better overall health, and also for having a healthier next generation. Thank you for the question, Mr. Looker.
Thank you very much, madam. Thank you very much.
Thank you.
Thank you, Mr. Luca. Thank you, Madam Shadrin, for the answer. Anybody has any other question? Or maybe we can invite our leader, Madam Malta. Please, you can unmute yourself. We also have our international trainer, Mr. Eric Tawa, and I can see Mr. Weissman. You can unmute yourself, or anybody want to ask question, you can unmute yourself.
Good
Yes,
evening. Good evening. How are you, Mr. Boardman, and our
Yes,
lecturers?
Madam Malta, how are you? We are doing great here.
Thank you so much for the training that we received this evening. It was very, very formative. I really enjoyed myself. I believe everyone who was listening has learned a lot. And we need to tune in every Fridays because we learn different things in every Fridays that we attend this training. And I would like to urge everyone to be very, very careful when it comes to their health, because health comes first, and you cannot reverse it very fast. Once you get sick, it will take very long time. They always say, if you don't take care of yourself, you may spend a lot when you try to cure a disease that has actually encountered in your system. So thank you so much, our trainers. We really appreciate. And as we're celebrating our leaders who are actually be leaving for Dubai, I would like to say congratulations to all those who will be going to Dubai. And I wish you all the best. And thank you so much, Mr. Budeman, for being part of this training as well. We are learning a lot. As for me, I am learning a lot, and my team is really appreciating all these teachings that you're giving us. Thank you so much. We appreciate.
Thank you, Madam Alta. Yes, I will bring your spirit. We know you as the Mama Africa. Now in Dubai, we bring the bigger delegation from African region, and we're really proud to have you as our mother. Though you are sitting in Johannesburg, but the whole Africa is under you. Okay, so I will bring your spirit to Dubai. I will share the spirit of Africa.
Thank you.
That we can do much better. Yes.
Really.
Okay. So any other, yeah, okay. Any other leaders or any other distributors or trainers who want to say something, you can unmute yourself, please. Mr. Eric Tower?
Good evening. Ni hao,
Yes, how
Budiman,
are
ni
you?
hao, Linda,
How are
and Ms. Shadrin. I'm happy. I've really liked this training, especially this evening, courtesy of Greenwald International Business School. We are really learning and getting quite a lot in terms of bettering our health and also, talking to our class because we are packed with a lot of knowledge. So we thank you so much, Mr. Budiman, and we can't wait to have Miss Linda as well as Miss Shadring back again. I think it's one of the best trainings for this week. I've really enjoyed it. Sleep is gone because we are really learning quite a lot. So I know as you even going to meet uh, Rainy in Dubai, you say hi. We are very grateful. You guys are doing a great job. And I know all the distributors, on this platform, each and every Friday, I want to believe this is not a time to miss a Zoom meeting. It's one of the best. Thank you. Wow, I've really liked it.
Thank you,
Thank
Mr.
you.
Eric
Thank
Tower.
you. Thank you.
Yeah. So we have our leader from Canada, Mr. Dr. Charles Wana. Are you there? Dr. Wana?
Yes, Mr. Woodman.
Yes,
Thank
we
you
want to
very
hear
much.
from you. How's Canada?
Canada is good. Is now warming up. Yeah, so
Warming
it's
up.
a exciting time to go outdoors. Yes. So
Okay, great, yes.
yeah, thank you very much for those presentations about the angina and heart attack and constipation and diarrhea. These issues, health issues, they don't know any geographical limitations. So they are also here in Canada. So I was delighted to listen to the two presenters. Very good job. Well done. And I took some notes, which I also use to deliver some presentation here in Canada. And of course, it's always a pleasure to be on this Friday Zoom meeting from Africa. And I learn a lot, quite a lot from you, Mr. Bunman, and Madam Rainey, and the rest of these trainers from Africa. It's always a delight for me to be able to come on. I always try to attend all the time because I get excited. I like the presentations and the presenters, and a lot to learn. I have a lot to learn because I don't know a lot about health. So for me, it's a learning experience. And of course, lots of exciting presenters from all parts of Africa. I know as we grow, it is going to be a team of professional presenters that will come out of Africa. And this is exciting for me. And thank you very much for always welcoming me to this forum. Thank you. And I hope to see you maybe in China or somewhere one day again. Thank you, Mr. Budiman.
Thank you, Dr. Wana. Thank you. Though, ladies and gentlemen, so Dr. Charles Wana is our top leaders and also the top trainers in Canada. And he's been doing so many trainings to our Canadian distributors. We are really grateful for the work of Dr. Wana. Though Dr. Wana is in Toronto, Canada, but his motherland is from Uganda. Yes, his motherland is from Uganda. So we are the same. We are from Africa also. Yes. Thank you so much, Dr. Wana, for your great contribution to, especially to green world in North America. All right. So do we have any other want to ask question or want to say something? Please, we still have time.
Yes, I wanted to ask that how can you treat a pregnant woman with constipation?
How to treat the pregnant woman with constipation? Yes. All right. So let me hand over this. Maybe Miss Adrien or Madam Linda, Miss Linda, want to answer this question?
I'm sorry. Pardon me. Please repeat the question. I was confused.
How to treat constipation?
How to treat a pregnant woman who has constipation?
How to treat a pregnant woman with constipation, right?
Yes.
Oh, that is very good question. For pregnant ladies, there's many precautions for them. For our products, we do not recommend all our products for constipation to them. Instead, we recommend pregnant ladies to eat more fresh vegetables and fruits to, increase their intake of cellulose, right? Dietary fiber. That is a natural source of dietary fiber, which is much safer, right? For our pregnant ladies, safe is the most important thing for them. So we recommend to take much safer source of dietary fiber from food, and please drink a lot of water, not too much, but adequate amount of water is good for ladies to improve the constipation. And on the other hand, the blueberry series product is much safer for them. The blueberry juice, blueberry super nutrition, much safer for pregnant ladies to improve their nutrient intake, right? The phytonutrients in blueberry juice improve their state of toxification from long-term constipation. And also pregnant ladies need a lot of nutrients, not only for themselves, but also for the babies, for the feeders. So blueberry super nutrition helps improve their nutrition intake, including the vitamins, minerals, and also phytonutrients, etc. So I think that's all. Thank you for the question.
Okay, thanks.
So, Ms. Adrien, are you saying that blueberry super nutrition is safe for the pregnant woman to take?
I think that is the safe product for them. Yeah.
All right. Thank you. Thank you. All right. So anyone else, do you have any question? Any question? You can unmute yourself.
Yes.
Mr. Bodiman, this is Miss Maforo from Zimbabwe.
Welcome, sir, Miss Maforo. Yes, sir.
Yes, yes. I just want to ask on the issue of hemorrhoid,
Hemorrhoid.
right?
Sorry, sir, can you repeat?
Seems like the connection is not stable.
Hello? And can you hear me?
Yes, can you repeat the question, sir?
I just wanted to know how to make sure.
Sorry. Can you unmute yourself? Sorry.
How to heal your hemorrhoids faster after improving the bowel movement. Which products can help us?
Hemorrhoids.
Hemorrhoid.
Fine.
Yes.
Yeah, for people with hemorrhoid, the situation is much tougher. You see, yeah, with the bleeding, with the itchiness, it's much, make people crazy. Yeah. So people with hemorrhoids, they should eat more fruits, vegetables, meal cellulose. We have product meal cellulose help with the, bowel movement. So if you have, smooth bowel movement, improved constipation, your hemorrhoid will be better. Meal cellulose is a choice. Another choice is catechin. But with catechin, you need to drink a lot of water, much more than you drink usually. Yeah, because catechin is a dietary fiber from animal source, from the shrimp shell, from the right? So it absorbs water, a lot of water to, make your stool much softer, moisturizer, so that your stool can be passed much smoother. In that case, it will give least stimulation, irritation to your hemorrhoids. That helps with the heal. Also, that helps with the heal of the hemorrhoids. And another tip is that our catechin capsule, you can open the capsule and put the inner content into a small, like a small ball or small cup, and pour a little water inside, right? Mix the catechin powder with water, and then apply to the hemorrhoid. If you have, arterial hemorrhoid, right? That helps heal of the wounds. Hopefully my answer can, be helpful to you.
Yes, Ms. Shadrin, maybe if I can
Thank you
add
so much.
something, Mr.
Thank you.
Maporo, maybe if I can add something about the hemorrhoids.
Mm-hmm.
So what causes hemorrhoids is actually by having this chronic constipation. So when somebody has chronic constipation, every time they want to release their poops, they go to the toilet. They have problems in releasing all these things to the toilet. Now, what they do, they will keep pushing and pushing uh, during the process of releasing the poops. Now, actually, hemorrhoids, when we see, we know there's like balls, like meatballs in the anus. That is not meatballs. Actually, that is the swollen of the vein blood vessel. So there's a vein blood vessel in the anus because now uh, the person just keep pushing and pushing. It creates an inflammation in that vein blood vessel in the anus. So that inflammation looks like a ball. So now, first, what we have to do, we have to taking care of this chronic constipation first. So after handling the chronic constipation, we can consider to handle the inflammation. Now, when we are learning from Madam Rainey, when we talk about inflammation, it means like anything that's swollen in your body. Yeah, we can say it's an inflammation. So the products for inflammation is we need to add deep sea fish oil and also pudding plus tea. So these two products will concern about relieving the inflammation of your body. Now, why we also need to give deep sea fish oil because we know deep sea fish oil is omega-3, and this will help to relieve the inflammation, the swelling of the vein blood vessel. Now, the omega-3 is playing inside the bloodstream, so it will help a lot. So we have two treatments now. First, you need to take care of the chronic constipation. Then you take care of the chronic inflammation of the vein blood vessel, which is causing the inflammation, like the swollen like a meatball in the anus. So that's what I can add from Ms. Shadrin. Yeah. Hope you get it answered. Yeah. Okay. Thank you, Mr. Mahfour. Anybody else? Mr. Michael, you unmuted yourself.
Hi.
Yes, Mr. Michael, go ahead.
Yes. Yes. I just want to thank you first of all and greetings. Send my greetings and thank you for this wonderful meeting. Even though when I come late here because I was on a street trying to sell my products from Greenworld. So luckily I sell two of kidney 25 from the woman and the man. They were needing it because they had a pains on a bed. And then I recommended that it was wonderful because it helped me once also. So they took it and now I arrived late. And then my question is that is this meeting every Friday or once a month?
All right, Mr. Michael, yes, this Greenwald African region Zoom training, we have this training on every Friday. Now, where is your location? Is it in South Africa?
Yes, I'm in South Africa, here by Savannah City in Vereeniging.
Okay, so for South Africa, every Friday, 7 p.m., the meeting will start, the training will start. So you just remember every Friday, 7 p.m., you can start to log in and learn more about the Greenwood products. Well, you have been doing great. Try to sell the products. So I wish you all the best and wish you can achieve the awards from Greenwood. Thank you, Mr. Michael. Thank you.
Okay,
Yes, I
thank you
can
so very
see.
much.
Hello?
Thank you, Mr. Michael.
Hello?
Yes, madam. Yes, madam, please.
Yes, it's Marinke from South Africa in Begersfort. You know, sir,
Yes,
I've
madam.
got a problem. I once had an accident in 2008. So I've got heart palpitations. I don't know what's the problem. And I've got something that is running rapidly between the diaphragm and the thyroid. So when I touch where there's a little bit of a hole, then I don't know, something is going very fast. I don't know what can you recommend me for that.
So when you have
Thank you.
accident, which part of your body that affecting? Is it your
It was the
chest?
chest. Yes, the chest.
You get hit on the chest. So now it's happening, the palpitation, like when you have this accident, madam.
In
It's long time
2008.
ago.
Yes, long time ago.
Long time ago. But now you feel that there is something disturbing, like your heart beating so fast, palpitation.
Yes, it hit so fast in such a way that my breast is
Yes,
even
Madam Marinki.
shaking sometimes.
You're
My
also
chest,
saying about the thyroid gland also?
my breast is even shaking sometimes when it starts with these
Your breast is even
palpitations.
shaking sometimes.
Yes.
So maybe Madam Reni, can you maybe help Madam Marinki? Madam Shadrin, sorry.
Oh, I'm sorry to hear
Hello?
that about that accident. Yeah, maybe there's some, complications after that. Did you ever go to the hospital, check with the doctor about that?
Yes, I did go to the heart doctor, the heart specialist
Cardiologist.
at heart hospital. Then he says he doesn't see anything.
You got the checkup, but nothing have been found, right?
Yes.
Uh-huh. The palpitations is a little, problematic for you. It can be irritating, and for the heart, the one product is very safe for the heart to use, the CoQ10, right? CoQ10 help with the ATP production and help improve your heart function, improve your intake of the oxygen and nutrients from the blood, right? So this product is recommended if you do not resist to that. And also deep sea fish oil is a good product. If you do not use blood thinner, any blood thinner, so you can use this deep sea fish oil for capsule. This is very safe one for people, most of people, if you do not use blood thinner, because it can, thinning your bloodstream, making your bloodstream smoother, right? Flowing. Maybe you can try them for some while and see if that helps. If so, you can, continue to take for some while. If not, maybe later sometime you still need to do some checkup, or you can, try to wait and see if there's any more symptoms happening, right?
Okay. Okay.
Hope you can get better.
Okay.
All right. Thank you, Madam Shadrin, Ms. Shadrin. So, Madam Marinki, Ms. Shadrin is telling us that you can take this coenzyme Q10 and also deep sea fish oil. Now, from my side, I also can suggest you take any calcium products because somehow calcium will help to relax the heart muscle because now you have the fast beating of your heart, you have the palpitation. Calcium products, maybe calcium capsule or compound calcium or compound marrow. You can select any of this. This also will help to relax your heart muscle, so it will reduce the palpitation also. Somehow also calcium will support the heart contraction, the heart soft muscle contraction, so you can have a good heart rate. Yeah. All right. So deep sea fish oil, coenzyme Q10, and any product of calcium upgrade. All right. Thank you, Madam Marinki. Thank you, Ms. Shadrin. Thank you, Ms. Linda. I think our time is up. Everybody, we are really grateful for the training by Madam Shadrin and Madam Linda. And Madam Shadrin, thank you for asking the question from our distributors. We really enjoy today's training a lot. So, ladies and gentlemen, stay tuned. Next week, we are still going to have another Friday Zoom online training. Though some of our leaders, we are still in Dubai, but the training will still go on. I will share the invitation next week. So stay tuned. And I think now we can unmute ourselves and say thank you and bye-bye to Ms. Shadrin and Ms. Linda.
Thank you,
Thank you,
Mr.
thank you, Mr.
Budiman. Thank you,
Budiman. Thank you,
everyone.
Thank you so
everyone.
much.
Thank you so much. God
See you
bless
next
you.
time.
Thank you. Bye bye. We really
Bye-bye.
enjoy. Thank you so
Thank
much.
Good
you
night,
from
everyone.
Bye.
Good night.
Thank
Good
you. Bye
night. Good night.
bye.
Good night. Thank you.
Thank you.
Thank
Thank
you.
you.